Hi, everyone. I'm Dr. Mike Bummer, and I'm here with my friend and colleague, Dr. Armin Feldman, for another edition of Car Crash Wednesday. Actually, let me minimize our case report that we're going to go over today so that you can see our, I was going to say beautiful faces, but I don't really feel that way this morning. But we're going to talk about a really interesting case here in a minute on thoracic outlet syndrome and a nerve injury that was really subtle, where my attorney asked me for some input because the insurance company was really giving them pushback on her current medical bills. You're going to see that we estimate and discuss medical costs as part of our reports that our attorneys use in settlements. And this particular client was getting pushback for even covering about $10,000 to $15,000 worth of medical bills that were directly related to the crash, and that's where my opinion was at. So, but let me first let Armin say hello.
Hi, Mike, and hello, everyone that's watching. We're so happy to have you on Car Crash Wednesdays live. And this is a really interesting case for, I think, one other reason, Mike. We actually didn't talk about this in advance, but now this isn't the case with this specific case, but low impact auto accidents, low impact auto crashes are always somewhat problematic. And it's not uncommon. I may be giving something away here, but it's not uncommon for people to develop thoracic outlet syndrome in a low impact crash. And of course, the opposing counsel and opposing physicians are going to say, well, this couldn't happen at this rate of speed. And we have very good studies to say, hey, that's not the case. So that's a little bit of a sidebar, but maybe we'll come back to that too.
These are very tricky. And for the listeners that stay with us through seeing some of the evidence we use and how we craft these reports, you're going to find this one particularly interesting. I think it's worth noting before we start, if you have any questions whatsoever, you can reach out to us at comments@physicianshelpingattorneys.com. Conveniently, Armin and I also do a more regular podcast, and you can find that at that same website, physicianshelpingattorneys.com, or anywhere that you listen to your podcast. So, Apple Podcasts, Google Podcasts, iHeartRadio, Spotify, you name it, we're cross-listed, and we have over 10 episodes there that we're proud of. So if you want to talk about a case, if you just have a question, if you want to know how much a case may cost for you to get a report on or a causation analysis, whatever it is, just ask us. This is how we operate.
In fact, we're recording an episode tomorrow morning.
Yep, I'm excited for that topic. But let's jump in. Let me turn off the eye candy here and open up. Oh, hold on. Here we go. All right. So you can see that, right?
Yes.
All right. So this is a comprehensive medical summary report. For those of you tuning in for the first time, our attorneys use these as part of their settlement demands. So they're including this during their settlement negotiations to get the feedback is almost universally that these are resulting in increased case value and invariably saving attorney time.
We'll also say that now some attorneys, they're in the minority, but some attorneys want us to produce these reports to do the medical case coordination. But far and away, attorneys ask us to prepare these reports to include as part of their settlement demand letter.
And you're going to see this is a 9-page report. To compose this, we are reviewing all the medical records, 8 different treating doctors oftentimes. We're doing about a 30 to 60-minute phone interview with your client. And as physicians, we're giving medical opinions within a reasonable degree of medical certainty or a medical probability, depending on the region. And we're composing these all medical problems, ongoing issues, and tying in the entire narrative for you to use in your negotiation. So we give a brief history of events starting out this specific case. She was crashed directly into her rear of a stopped vehicle. This woman, by the way, was about 50. She was 54 years old. And after the crash and in the interview, she said she braced herself because she saw the van coming behind her. Her sunglasses flew off her head and her neck flew forward and back, and her vehicle was totaled. She went to the ER actually the following day because she had said her adrenaline was flowing and she had to get to work. How common is this story?
Yeah.
And the next day she was hurting everywhere. So she went to the ER and she just couldn't take the pain anymore. Not surprisingly, her chest and shoulder x-rays were normal. A CT of the cervical spine was normal. So we don't have any hard evidence of any injuries at this point, which is, oftentimes why our attorneys are getting pushback.
So let me jump in too, is that this is a typical soft injury case, right, Mike? And so, again, it's not unusual to get some kind of pushback from opposing attorneys and doctors in soft tissue cases, particularly when there are significant injuries.
And what's interesting about this case that you're going to see in a lot of these, this injury really crept up on her. So again, here, the meat of these reports, other than estimated future medical costs, which can be really helpful, the meat here is this ongoing medical problems area. And we try to keep this concise and written in layman's terms so that the adjuster, opposing counsel really understands what we understand as the physician making this opinion. So you have neurogenic thoracic outlet syndrome. And I make this opinion within a reasonable degree of medical certainty. Directly due to this crash, she's left with these problems. So it was documented. And here's where we paint the picture and build this up. Her treating doctor, Dr. Reynolds, this is all redacted if I didn't already mention that. Her treating doctor documented that the pain was diffuse throughout her neck and back, showed a visual diagram, and said that it went into her right wrist, hand, forearms, and thumb, which is coming later.
Let me jump in again. So that's a little problematic for us too, because if we can show that the pain, for example, is pinpoint and not diffuse, it by and large in these auto crash cases, it does make things easier. So with diffuse pain, our attorney clients and of course we as physicians have to nail that down to help people understand why the pain is diffuse.
That's a great point. And not luckily for her, actually, very unfortunately for her, it does get rather isolated. But so at this visit, it was also documented she had a tender right wrist and hand, lateral right forearm, which all was a new finding. She had a positive test at her elbow and wrist of paresthesias, including tingling, that indicated possible nerve damage. This is all just kind of, lingering in the record. In the weeks following, she continued to be in severe pain. She said her right thumb hurt a lot when she tried to use it, and he documented this. Again, remember, the primary reason for this report is the insurance company was saying that this injury to her thumb and all these medical bills that she accrued because of this right arm and thumb pain were not related. It's documented, this history. We just needed to put it together and make sense of it, because it is a little bit dicey when you get into the specifics. Then 2 months after the crash, Dr. Reynolds did recommend orthopedic consultation because she was still in a lot of pain, primarily in her right hand and right thumb. Moving on, she sees Dr. Taylor, who's a orthopedic or physical medicine doctor. He noted she was unable to oppose her right thumb to the fifth finger. She was taking Celebrex, using a wrist brace, wrapping it, icing, again, painting the picture that she's doing everything she can. This isn't getting better. Now, many months later in November, she says, and in the notes, she still can't use the right thumb like she did before the motor vehicle accident. And then as you really go through this whole literature, this is kind of where it ends. And this is now left and kind of handed over to us, because now they're saying, the insurance company is saying, we don't want to pay any of these bills. So after thoroughly reviewing the medical record and interviewing Ms. Carter, it was then my opinion that she suffered a whiplash injury and thoracic outlet syndrome as a direct result. And here's where I make the case. So she talks about twisting things. Opening a can of soda is even very difficult. And we're now like 2 years after this injury. On average, she says her pain is like a 2 to 3 out of 10. But with fine motor activity, it's 5 to 6 out of 10. Now you're going to find out she's a hairdresser. Pretty important. So including research in these reports, and all of this, again, is affordably combined into this comprehensive medical summary that we're putting together for our attorneys. Found a medical paper. finding these articles, Armin, isn't it the most fun when you find an article that absolutely proves up
Yeah,
like which
it's
one?
a eureka experience, isn't it? Let me just say a couple of words about thoracic outlet syndrome. I don't
Yeah,
know if you were going
please.
to say that. So for our attorneys that are watching today, so there are a series of nerves that come out of the spinal column, and nerves that come out from the C4 level through the T1 level. Uh, Kind of come together. They go under the clavicle, the collarbone, and then they go over the ribs. And at this point, they're bundled, and that's the brachial plexus. Then those nerves will go under the armpit, down the arm, all the way through the fingers. And so that's the thoracic outlet, is these bundle of nerves as they go through that anatomy, and particularly as they cross the chest and go down underneath the armpit.
You know, what was strange about this, the attorney even asked me and said she was running into a lot of difficulty because the client didn't go to the ER for thumb pain. And how do you, like, she thought she would have been grasping the steering wheel and, thrown forward and hurt the thumb. But
Right.
in reality, I believe very strongly, as I make this whole narrative, that the mechanism of this thumb pain was probably due to a cervical injury, where when a car is hit from behind, and this is verbatim from this research, the body, supported by the seat back and seatbelt, accelerates while the head is not supported and remains still. And this induces the stretching of these neck muscles and brachial plexus. And that's how it can actually cause nerve pain that would hurt someone's forearm, hand, thumb. And it's just not readily apparent to lay people how this could be possible.
Right.
So again, moving on to describe how this injury occurred and what the mechanism is. And interestingly, it's also well known that these intense and sudden muscular contractions, where that seatbelt or where the injury occurred,
Right.
can leave the woman or person in a state of prolonged contracture, get myofascial syndrome and trigger points, which are going to, further complicate pain and issues. And it can even, this post-traumatic contraction can even further prolong compression of the nerve trunk. So when there's contraction and inflammation and stretching, it doesn't even always happen right away that the nerve trunk is compressed, but that can swell and occur over time.
Yeah, let me just say a couple of words about that. I think you quoted this paper later in your report, but there was a study of over a couple of thousand people with thoracic outlet syndrome. And what they found is the vast majority of these people had congenital bands and tiny little ligaments over their scalene muscles. These scalene muscles are tiny muscles in the neck. And these bands get stretched, the scalene muscles get stretched, they scar. And that's why it isn't immediate, because this scarring needs to take place. So that can be weeks or months later, and that compresses these nerves. And I think you quote that article.
Well, it's a slightly different paper. I actually have to get that one off of you.
Yeah.
But this one that really jumped, this different paper jumped out. It talks about the sequence of events of of thoracic outlet syndrome. And what I loved is it said patients typically note neck pain within the first few days, and arm and hand symptoms are delayed a few days to several weeks. And then I lay this all out again. Our watchers can see this, or let us know if you want this redacted report or any others. We're happy to send them to you. Again, it's at the comments at physicianshelpingattorneys.com. I'll just put that up there for a second. But this was exactly this client's experience.
Right.
Like, this paper could have been a paper about her. And clearly the opposing counsel insurance company didn't know about it. My attorney didn't know about it, but it was her in a nutshell. And
Great
again,
article to find.
it really was. And I love what we do, Armin, but we do this quickly, affordably, and make it very, very simple as our way of consulting. We've talked about relating causation in other Car Crash Wednesdays, so I don't want to spend a lot of time on this. I know everyone's time is precious, but we, as part of these reports, have a method for demonstrating causation and determining causation following traumatic injury. And there's criteria. We often go back to the Freeman criteria. If you have questions about this, let us know. But there are 3 criteria. There must be an exposure, there must be a time relationship, and there must be an outcome that is otherwise unattributable to something else. And we make this very clear in these reports. So again, her complaints were pathognomonic for thoracic outlet syndrome. She had sustained a serious whiplash event, left with these issues. I'd like to kind of jump through some of this. I had highlighted again. Let us know if you'd like this report. She was right-handed, works as a hairdresser, and this injury affected her activities of daily living. I mentioned a story here where she has a jug of water that she uses every day that she can't even really pick it up and trust her right hand. It's been over 2 years since the crash. She still feels her hand and thumb pain every day. So then I make an opinion that she suffered this whiplash injury, and it may in fact even be permanent given it's been 2 years.
Right. So we always want to put, not only will we talk about mechanism of injury and causation, but we also want to talk extensively about what are the functional losses as a result of this injury.
We include verbatim notes as we are not treating doctors. We include these from the medical record. There's a lot here, so I'm just going to scroll through these. We get to a very critical part of this report. And for this client, her medical costs to date were really the focus of why the attorney brought me involved, because they were essentially denying covering all of these costs, and they didn't think it was related. And we're talking of just under $15,000. And the client works as a hairdresser. You could imagine this is a large sum of money to anyone, but this was traumatic to her financial life. So it was easy to attribute these costs directly to her thoracic outlet syndrome and the car crash. But then in all reports, we also estimate our future medical care and costs to the best of our ability as a physician, and make these estimations based upon life expectancy and a breakdown of what we think the future care and costs might look like. So we run through in paragraph form, again, very easy, explainable on why we believe, she was going to need a nerve conduction study. An MRI of the neck could rule out pressure on the cervical spine. She's going to benefit with TOS from a multidisciplinary approach with neurology, orthopedics, physical medicine. Physical therapy tends to be the gold standard for treatment when it's detected early enough. That may not be possible for this client. And here's again where I bring up that, given it's been over 2 years, it's very possible that her condition may be permanent and a direct result of nerve compression. And ultimately, I didn't include this in my estimated future costs, but decompression surgery may even be recommended. I just wanted my attorney client to be aware of that if it was going to help in negotiation.
I think it's more likely than not that this is a permanent condition, right?
It very well could be. And, I try not to make these estimated future medical expenses too outlandish because it has to be realistic. We know this. It has to be directly related to the crash. It has to be regionally specific when able. And this graph is a rough estimate of what I believe the future care as directly related to this crash was going to be. And it was an additional 37 plus thousand. And these are all numbers that we calculate and run that are specific to each case, of course. The medications that would be used for this type of pain are anti-inflammatories. Interestingly, about a gym membership, because she's going to have to go through rehab and physical therapy and trying some of these other treatments. So if anyone has any questions, if there's any viewers out there, we had 74 RSVPs today, Armin.
That's just great.
I know a lot of people are going to be watching on the replay. If you're watching on the replay and you want any more information, just drop a comment below the video. Again, I'm going to put up our banner here for our email address. You can listen to us on our podcasts at that website, physicianshelpingattorneys.com. But before we move on, Armin, do you have anything else that you'd like to add on this case or anything in general?
I think this is just a great example of a soft tissue injury case, as I said earlier, where there were significant injuries, and we were really able to help the attorney and help the attorney's client by helping them to prove up this particular injury. Nice report, Mike.
Thanks. Yeah, I did this one a little while ago, and when we went back and decided to use it for today's Car Crash Wednesday, I'm not going to lie, I always get a sense of pride when I deliver these. We've mentioned it before. It's almost like turning in a term paper in the good old college days. We put a lot of work into this, and it's not something that every doctor knows how to do. That's why we've really found this niche of medical legal consulting that is separate from what the treating doctors produce or are often interested in doing. Very different than medical expert work in that it's much quicker and much more affordable. And yeah, it's just been a delight to be able to help and serve our attorneys and clients by producing these.
Right. So if you have a case or if you have a question or if you have a comment, as Mike said, please send us an email at comments@physicianshelpingattorneys.com.
All right. I hope everyone has a great week.
Have a very happy holiday, and we'll see you after the first of the year.